Hello, my name is Dr. Joseph Lawrence and I'd like to thank you for visiting our site today regarding fibromyalgia. First off, let's review exactly what symptoms fibromyalgia gives for patients. For example, are you suffering from achiness and pain all over? Are you suffering from fatigue, difficulty with bowel or bladder function, sensitivity to light, sometimes unsteadiness, imbalance? Are you suffering from issues where you've got brain fog, where you can't concentrate properly? These are some of the conditions that I see day after day that come to my clinic here for individuals that have been labeled with this fibromyalgia. What frustrates me, however, is when I see these people come in and how they've been diagnosed whether they have fibromyalgia or not, is having these 11 of 18 painful points. Personally, that doesn't cut it when it comes to diagnosing fibromyalgia. In fact, I don't even like the term fibromyalgia because really what it is a condition that's made up of several different causes. But for our purposes, we use that term because it's something we can identify with. First off, fibromyalgia has a large influence by neurological involvement. For example, part of the brain, called the upper brainstem or midbrain, tends to overfire in these conditions. What we'd see with that sort of issue is sensitivity to light, gastric issues with constant constipation or diarrhea that will fluctuate between the two. Difficulty with pain in the joints. This type of issue can be easily treated utilizing what's known as brain-based therapy. In fact, as a functional neurologist, our unique approach will help treat individuals that way in a painless fashion. It's very successful. The other portion of the involvement for fibromyalgia tends to do with the metabolic involvement. This is where it gets very interesting. We can have involvement for things coming from, for example, leaky gut, parasite problems. It could be due to blood sugar dysregulation. Could be due to low thyroid function. Could be due to undiagnosed bacterial or viral infections, and the list goes on. But here's where the real kicker is. Unfortunately, when individuals come in, they'll sit in the chair, cross me, and most of them will be crying because they've been told they have to live with it, or they've been told it's all in their head, and they get depressed or been prescribed some antidepressant. The issue lies in the fact that how you look at laboratory results. A lot of cases, laboratory results we use in this country are very wide-based, and in fact, what you'll do is you'll miss a lot of individuals that actually may have problems but be considered normal. In our case, we use what's known as functional ranges, which are narrower, so we can red flag problems a lot earlier. This way, it isn't in your head, we can actually show you that there is a real problem. Our approach is unique and only one of its kind in Canada. As a functional neurologist utilizing functional diagnostic medicine, we combine the neurology and the metabolic approach to help give you the best results and outcome. I sincerely wish that you give the time to think about this, and if you're really looking for results for this sort of issue and learning the fact that we can help you, I encourage you to call our office to determine if you're a good candidate for care. I look forward to seeing you. Thank you.